Topic is the language of responsibility. Follow along on pages 216 to 222.
Our first topic is it statement. Statements that replaces the personal pronoun I by less intimate word it. Communicator who uses it statement avoids the responsibility for ownership of the message. It statement basically the unconscious way to ignore taking position. For instance, it's nice to see you instead of I'm glad to see you. The healthcare-related example for this specific topic would be it is good to see a doctor once in 6 months for good health, instead of I need to see a doctor once in 6 months for my blood work. In this example, person uses it instead of I, which shows that he or she doesn't want to take a position and admit that he or she needs to see a doctor for blood work. Another statement is called but statement. The word but cancels out the exceeded expression. But statement is strategy for wrapping speaker's real but repulsive message between more palatable ideas in a psychological sandwich. Most of the times, doctor uses but statements. For instance, it is an easy and clear surgery, but there may be some complications associated with your age.
We are able to remove the tumor, but there will be complications.
What is a question? A question is essentially an interrogative sentence that asks about someone or something. There are two types of questions. The first type, direct questions, uses a question mark in writing, are genuine requests for information. Here's a healthcare example. Did you remember to take your medication every day?
Did you feel any kind of pain or uneasiness during the surgery?
The second type of questions, indirect questions, sometimes uses a period at the end of the question when writing. It is a linguistic method of hinting something to avoid making a statement or to hide the true meaning of the question. For example, a physician may ask, have you noticed any side effects while taking the medication, instead of asking, did you remember to take your medication every day?
Did you take the medications that were prescribed to you before we began the surgery? So we can continue on with the surgery.
Yeah! The I language identifies the speaker as the source of the message and is a way of taking responsibility. A complete I statement consists of 4 elements that can appear in any order within the statement. It includes the other person's behavior, your interpretation, your feelings, and the consequences of or how the other person's behavior affected you. For example, a patient who feels uncomfortable with their doctor not listening to his concerns may say, I know you're busy, which is the interpretation, but I feel uncomfortable and rushed, which are his feelings, when you keep interrupting me without letting me finish my description of my symptoms, which is the other person's behavior, in this case the doctor's, and I'm afraid that I may be misdiagnosed, which is the consequence of the doctor's behavior.
Do you have any questions before we continue with the delivery?
I feel uncomfortable. Is there any way you can go through the procedure with me before we start, because I feel it's too early for delivery?
The language that we would be talking about today is the you language, which is a judgment of the other person. You language doesn't have to contain the pronoun you, which is usually just implied. For example, when we say don't be so critical, it can mean you're too negative. For another example, somebody can say that was a stupid joke, which would mean your jokes are stupid. You language can provoke defensiveness, as you statement implies that one is qualified to judge the other, which is hard for people to accept.
Did you follow up John's discharge papers?
You did his admission papers, so I think you should do the discharge ones too. The next language we'll be talking about is the we language. These statements imply that the issue is of concern to both speaker and the receiver of the message. For example, somebody can say, we need to figure out a way to get through this situation. Another example would be, we need to do this project together before the deadline. The term we can help build a constructive surroundings, as it doesn't sound selfish, but more as we are in this together.
Organs will shift, and there's a great deal of damage.
So, if you move me, I'll die?
We're gonna do everything we can to.
The video clip from Grey's Anatomy is an example of V language. In this example, Dr. Shepard states that they have to work together as a team to save both the patients. He says that we are going to do everything we can, which uses the we statement as we discussed before. In the medical environment, it is important that the healthcare professionals work together to fulfill healthcare needs of the patients. There are also some disadvantages to the we language. We language is not always appropriate as it can be misunderstood. It can sometimes suggest that you are speaking for the other person as well as yourself without them knowing. For example, somebody can say, "We haven't handed the assignment in on time," whereas it can just be that "I have handed in mine on time, just you haven't." Some of the tips for we languages are, when using the we language, we should combine it with the I language. It can be used in group settings to enhance unity of group. We language should be avoided when talking and expressing about personal feelings, thoughts, or wants.
Now we are going to conclude our presentation with the game to reinforce the understanding of the content. You have definition or examples of all the topics that we had covered in our presentation on the left side of the PowerPoint. You have to match those definition examples to the terms on the right side of the PowerPoint. Here is the list of our references, and thank you for watching our video.